A heart attack occurs when blood flow to a part of the heart is blocked, usually by a blood clot. Without oxygenated blood, the heart muscle begins to die. A stroke is a brain attack, cutting off vital blood flow and oxygen to the brain. Stroke happens when a blood vessel feeding the brain gets clogged or bursts. Did you know? Stroke mortality is significantly higher here in the Caribbean than in developed countries. In fact, the mortality rate in Grenada from cerebrovascular disease, such as stroke, is more than twice the rate of North America. The Pan American Health Organization has also noted that the Caribbean has the highest death rates from heart disease in the Americas. In fact, in Barbados alone, 3 in 10 women are clinically obese, and this is expected to double in 10 to 15 years. 1 in 5 people have diabetes and hypertension. There are 3 strokes every 2 days, according to the Heart and Stroke Foundation of Barbados. So, why is there such a high incidence of heart disease and stroke in the region? One of the reasons is that we have a much higher prevalence of some of the main risk factors for heart attack and stroke: high blood pressure, family history and ethnicity, age, inactivity, binge drinking and substance misuse, oral contraception and hormone replacement therapy, smoking, diabetes, and obesity. The rising obesity epidemic reflects the profound changes in society and in behavioral patterns of Caribbean communities over recent decades. As incomes rise, diets high in complex carbohydrates have given way to more varied diets with higher proportion of fats, saturated fats, and sugars. Of particular risk are women and girls. The Caribbean mortality rate for diabetes is also significantly higher than that of North America. In the English-speaking Caribbean, diabetes is a major public health burden. The steep increase in the prevalence of obesity and the increase in sedentarism in Caribbean societies are the main risk factors driving the diabetes epidemic. What most people don't know is that there is a risk factor multiplier effect. 1 risk factor doubles your risk of a heart attack or stroke. 2 risk factors quadruple your risk, and 3 or more risk factors can increase your risk more than 10-fold. The early warning signs of a heart attack or stroke are: for a heart attack, fatigue, chest tightness or pain, pain in one or both arms, and nausea or indigestion. For a stroke, dizziness or loss of balance, confusion, speech problems, and numbness on one side. Treatment is most effective when given within the first few hours after having a stroke has occurred, so it's important to recognize the symptoms and act quickly. If you suspect a stroke, call your emergency number immediately. Vital treatment can begin in the ambulance. Strokes can and do occur at any age. Remember, nearly 1/4 of strokes occur in people under the age of 65. What can you do to make a difference? Educate yourself. Get checked. Know your numbers: blood pressure, BMI, cholesterol, and glucose. Prevention begins with knowing your risk. Conduct risk assessments on your family and on your staff. Volunteer and give generously to your local Heart and Stroke Foundation. You can make a difference.